Fever is one of the most common questions I get from parents. I'm Dr. Elizabeth Meade. I'm a parent, a pediatrician, a medical director within Pediatrics for Providence, Swedish, and fever is one of my favorite things to talk about because I think it's something that can be so anxiety-provoking for parents, but most of the time is no big deal. One exception to that is if you have a young infant with a fever. So for us, fever is anything more than 100.4, and if you ever have a child under the age of 3 months old who has a fever higher than 100.4, they need to be seen right away, whether that's in your pediatric clinic or in the emergency room if the clinic is closed. For older infants and children, we really worry much less, and that's because they've had usually that first set of vaccines, and they're much more protected against some of those dangerous bacterial infections. Fever is something that is part of our body's natural response to infection, and it's actually a good thing most of the time, so it helps really fight off those germs. But there are a few times when we might be worried. If your child is having persistent fevers higher than 104, 105, fever that's not coming down with medication, or if your child seems lethargic or irritable or really not themselves, those are times when we'd want them to be seen by a healthcare provider. If they have a fever that's lasting more than 10 to 14 days and not going away, they definitely should be seen as well. But most of the time, we're just going to tell you that you can use fever-reducing medications to keep your child comfortable. If your child has a fever and they're not bothered, they're not uncomfortable, you absolutely don't have to give those medications. We really reserve those for times when kids are not feeling well, and those meds bringing down the fever can help them feel better. If you ever have a question about fever in your child, call their healthcare provider. It's always better to check in and be safe than sorry.